Thanks for still being there. Of course, it's still Rise and Shine, the Friday edition. And we've been talking gender-based violence this morning. When we talk gender-based violence, it's about the woman, it's about the man, it's about the boy child, it's about the girl child, and how connected are we as a community to make sure that we are speaking up in terms of anything that is happening against people in the environment. We still have with us on set this morning Dr. Ugochi Onyinye. We also have Dr. Gideon Ayo, Dr. Onyinye Ugochi. I saw her squeezing her face. Yeah, Gabriel Ayo. Yeah, so we also have, they are members, they are from the EQ's, I'll call it a foundation.
NGO, please.
NGO, yeah. Addressing gender-based violence issues in Akwa Ibom State and in 17 other states. So I wanted also to touch a little bit on the clinical aspect of addressing gender-based violence. When these people come to the facilities, what kind of procedures are available to them? Because we must know how to take them out of the situations clinically. Are there clinical solutions for gender-based violence?
Okay, thank you very much. Depending on the kind of violence meted out to an individual who presents to the hospital, either it's physical, sexual, emotional, or otherwise. If it's physical, we offer clinical services based on the presenting complaint. And then apart from the clinical services we offer, for example, I work in the University of Uyo Teaching Hospital. Any victim of gender-based violence who presents to the hospital, after offering the medical services, we link them to legal aid. We actually ask, do you want to? Because yes, some of these victims, they are more open to sharing their experiences with a physician because they know the person is offering care, holistic care to the person. So some information they will not likely share with others in the consulting room, they actually open up and share it. So at that particular point in time, after offering the medical services, we offer legal aid. You understand? So like EQUIS, we actually partner with other NGOs and governmental organizations. We partner with the MBA, the Nigerian Bar Association, the Nigerian Medical Association, even the Medical Women Association of Nigeria, and FAREP, the brainchild of the Excellency, the wife of the former governor of Akwa Ibom State, Ms. Martha Udom Emmanuel. So we actually link up and buttress this intersectoral collaboration to actually offer holistic care to victims of gender-based violence.
So that makes it sound like the clinical aspect is one of the strongest ways we can nib it in the bud. Yes. If it is easy for a violated person to talk to their clinician, it means the legal aspect needs to really sum up. We know that yesterday the Attorney General of the Federation was saying they're going to put in principles on ground to address gender-based violence in schools. It is on the rise where we see a lot of people violated in schools from primary schools upwards into the university. So talking about EQs and your community approach to addressing these issues, what programs do you have for addressing gender-based violence in schools, especially educating maybe the young ones to know and be self-aware when something is an abuse?
Okay, thank you very much. So for us as EQs, we are an indigenous non-governmental organization and we have programs in place. We have the AYP hub, what we call the Adolescent and Young People Hub, set up in most of the states we are present in. And what we do in this hub is that the young people, the adolescent, because it's not just about age, we see molestation, we see rape and all that. So for the young people, we bring them out from the society, from the communities, and we empower them with vocational skills, because when women are empowered, they are less vulnerable. It's been proven they are less vulnerable to, and they're more aware because they are financially capable to at least take care of themselves. Apart from that, in the AYP hub, we do training. There's this no means no training. So because no is a complete sentence, and when a girl child or a male child says no, it has to be respected. So during the no means training, we teach them how to fight, where not to touch, where it's sensitive, your body parts that are sensitive to you, how to protect yourself even if you are about to be gang raped or something, how to fight. So this No Means No is an international program which EQs also through its system provides to the Adolescent and Young People Hub. As well as we have helplines, we also have people in the systems. So during our package of care, during implementing processes, if we discover that there are people who have been sexually abused or emotionally abused or physically abused, we link you up as Dr. Ayuas, we link you up to our package of care. If it's not directly provided by ACUs, we have collaborations and partnership with other implementing partners, as well as funding from the United States government as well. So we make sure that with everything within our capacity to make sure that victims of gender-based violence are taken care of. And we also talk about consent. We tell people that you must seek consent. Consent, when someone says no, it actually means no. Consent is very important. And for community people, capacity building, as I mentioned, vocational skills, empower the girl child, give them leadership positions, to lead. When a woman is empowered, she can save the community.
Very strong conversations we've been having this morning. Of course, speaking with our guests on gender-based violence. It's been 16 days of activism to see how we can make sure that the girl child, the boy child, the male and the female, we even talk about the violence happening in the workspace. Everyone needs to be protected from this. Must say a very big thank you to our guests for coming on the show this morning. They've shared a great wealth of knowledge that we absolutely appreciate. Of course, we've had Dr. Gabriel Oyor, who is a clinical care associate with ECUS, and we also have Ugochi Onyinye, who is a communication assistant with ECUS. A wealth of knowledge you'd want to come back on, so follow us on YouTube and on our website at spectrumtvlive.ng to get a hang on everything that they have said. Let's see how, as a community, we can help everyone who might be suffering gender-based violence. At this point, we'll take a quick break, and when we return, we'll be having a short interview just talking about AIDS this morning. Stay with us.
Christmas season is here again. Are you aware that making your business or product visible on the television space gives your brand a wider visibility and patronage? In the spirit of the season, Spectrum Television is offering a whopping 25% discount on all services. Advertise your products and services while this offer lasts from 1st December 2023 to January 31st, 2024. We are a television with a passion to take your business and services on a satisfactory lane. You do not want to miss this opportunity. For more inquiries, visit our city office at number 2 Taft Plaza Close off Kakaitinen Road, Uyo, Akwa Ibom State, or call the following numbers on your screen. Spectrum TV, broadening your horizon.
Welcome back and thanks for still being there. Of course, it's still Rise and Shine, and today is the International World's Health HIV and AIDS Day, I beg your pardon. And of course, the conversation about HIV and AIDS has transcended over the years. Technology has moved. A way to combat the disease has also been innovated. But it looks like in recent years, the numbers have been skyrocketing in Africa. And it looks like there's still a prevalence of the disease, although we seem to have made progress over the years. We have a guest here on set who will be talking about the import of today's celebration globally. We have Dr. Mary Enyeni, I hope I got your name right, I apologize, clinical service specialist with ECUS. Good morning, man. Thanks for joining us. Yeah, we also have with us Dr. Bala Gana, state director at ECUS. Thank you for being here. So we have such a short time. It literally might take just one question each. But today is the World, International Day for AIDS. Like I said, we have made progress, but we seem to have plateaued and we're going back down. What's really happening with HIV/AIDS? Let me start with you, state director.
Yeah, thank you so much. A lot has happened and a lot is happening. Nigeria has made so much progress with all the work that happened with HIV. In 2018, there was a nice study that showed the prevalence where we stand with HIV, and that from that study we saw that Akwa Ibom in particular had the prevalence of 5.5, which was the highest in the country. But Since then, a lot has been done in terms of the search, going out into the communities to identify cases. And right now, I would say that it would be good for us to look towards another survey that will actually give us a true picture. But a lot of people have been placed on treatment. There's a lot of awareness, and a lot of work has been done, with addressing the pandemic. As you will see, the global theme for this year is Let Communities Lead, and for Nigeria, that theme has been domesticated to community leadership to ending AIDS by 2030. And so we're hopeful that we can get to that point.
Ending AIDS by 2030, does that mean that we're going to be having like absolutely no persons living with AIDS, or the transmission of AIDS is going to stop? Because that's something we must know when we have that kind of targets. What exactly are we looking at? And then from there, you can break us into the conversation of having the community's hands on deck with handling AIDS.
All right, thank you very much. So when they said let's end AIDS by 2030, doesn't mean that AIDS will just go. What it means that there will be no recent infection, meaning that like now we're identifying new cases, meaning that what we'll just have will be the clients that are already on treatment. In terms of like mother to child transmission, that would have stopped. It just ends with the mother. So no new infections by 2030. So that's the end when you say let's end AIDS by 2030. Then you're looking at let communities lead, because you know that when the communities take ownership of this, to drive the process is easier. It makes it more, they own the disease and they are able to preach the message to the communities. Imagine now, if in a community there's an awareness, and the community themselves, the community leaders, use their space to say, okay, come, let's do this as an outreach point to do testing. And there's no form of discrimination or stigma. It makes everybody open to assess HIV prevention and care in that community, because the community leadership has already taken that ownership. So that's the idea. Let communities lead, because by 2030 the international donors would have withdrawn their funds from us, and it's now left for us to take over. So we need to start owning this by ourselves. So that's why we're saying let communities lead, because when we see communities take ownership of something, it's easy to sustain the response.
The conversation of having donors and investors withdrawing their investments and the aid that they have been given, the likes of USAID and a lot of those, when they withdraw their investments in terms of funds, how is it going to be, the whole program, how is it going to be sustained? Is the federal government going to be taking on the treatment? Because right now we know that the treatment for AIDS is free, across the nations, of the world. So how is it going to be? How is Nigeria positioning to be able to take care of that? 2030 is a couple years, or do we, I know that some of these projects, do we start looking for new variants on how to expand, and sustain the projects? Director, sir.
Yeah, thank you so much. The PEPFAR fund, one of the major funds for HIV programming, started sometime in 2003. And if you look at the trend over the years, there's been dwindling funding over the years. And we also have funding from Global Fund, we have funding from private individuals. The discussion for sustainability has long begun, and it's still ongoing, to be able to get the country, the government of Nigeria, their buy-in to ensure that they're beginning to take up responsibilities, to also the discussions around public-private partnership, having individuals, Nigerians who are actually supporting the cause also. So it's not something that would happen overnight, but discussions have started. We're seeing a lot of traction. We're seeing state governments bringing funds to get test kits. We're seeing state governments, so it started, the discussions have started, and I believe that if we continue in the trajectory, there's hope that even when there's withdrawal from donor agency, Nigeria will be able to, stand the
To
test
stand
of
on
time.
its own. Okay, we'll take one last question, and that'll be all we can take for this morning. Still, let's baseline on community. What would you say is the response level with regards to community in Akwa Ibom State, leveraging on the traditional rulers and all of those community level activities? How would you say your penetration into the communities is doing currently? Because if we take advantage of that, we will be able to meet that 2030 target.
All right, so as a state now, right, we're working in 31 LGs. So far, as an agency, we have actually mandated our teams at different LGs to actually work with the community stakeholders, the gatekeepers in the community. So the response so far has actually been good. We're actually getting there, but we are not there yet. But we want them to actually take ownership. So in every LGs we have, the LGA manager actually meets with the community gatekeepers. So that has actually made foster relationship between us and the communities. So we're even going as far as, okay, let the primary health centers we're working with, let it be the government staff there that are actually taking up these responsibilities, and we are on the backstage. So they do the activities and we follow them behind. So whatever communities we're entering, we don't just enter by ourselves. We go through the facility, through the community gatekeepers, the paramount rulers. So if you look at the World AIDS activities from Sunday up to now, you're seeing all the pictures coming out. We are going through the communities. Whatever we do, we take the communities along. So the response is good, but it can be better.
Okay, community people living with AIDS, how is their response? Apart from penetrating, do you have them come out and take advantage of the, aid made available for the condition?
Yes, they actually come out.
So the response is good?
Yes.
All right, we've been talking HIV/AIDS today. Of course, today is the International Day marking and observing conversations and pushing activism around HIV/AIDS in the globe. And we have been taking our front and our side of the story on Spectrum Television with members of ECUS. Of course, we've had the state director for ECUS in the person of Dr. Bala Gana with us on set. We've also had Dr. Mary. I'd like for you to help me with your surname.
Annie.
I will still not get it right now. But of course, she's been here, clinical service specialist with ECUS. Great conversation. It seems like we're making good progress with HIV and AIDS. And we do hope that with all that we do, we'd have more people living properly and well by 2030. We hope that this conversation is just baseline. And we hope we have also made progress with regards to people living with stigmatization. I hope that has dropped, Director, sir.
Yeah, so there's some progress. I mean, the state is unfortunately we couldn't get the accent of the anti-stigma bill the last administration, but that discussions have started again, and the more we talk about it, the more people are empowered with information, knowledge. Fear reduces, people are opening up, and I think we're making progress.
All right, there's an anti-stigmatization bill that will be represented to the Akwa Ibom State House of Assembly. We do hope that under this administration it does receive an accent. But that's the much we can take on the Friday edition of Rise and Shine. It's been a bumper ride this morning. Thank you for doing this with us the whole week. Until we return to your screens again next week, my name remains Uyai, and you can enjoy the rest of your day and the rest of your weekend. God bless you.